Hi, my name is Abigail Bennett, and this is my week 4 discussion. So, some of the ways that I've observed trauma-informed care at my SELs, I'm going to start with community and then move into the next one. So, my community is at WIC, so you see a lot of historical traumas, especially with like migration and stuff. And then children that come from abusive and neglectful homes, that's also something I see very often, and I watch the dietitians do a pretty good job of catering the care for that situation. And then poor budgeting and planning is common, and then heavy consumption of convenient foods and food restrictions. So all of these are things that I noticed at WIC. And then some ones at the clinical. So these are, again, like things, some of these could be things that caused the trauma, a result of the trauma. I should have included that in the last slide. But at clinical, there's unpredictable meals in the older population. So when I would speak with them on my own, and ask them about their diet and how they eat, how many meals, it was all over the place. Sometimes they go days without eating. Some of them, they're forgetful because of like dementia, and, sometimes they just have a hard time preparing foods, whatever it may be. And then disordered eating patterns in all populations. I would see that a lot in the young populations, but sometimes in the older ones as well. High fat, sugar, and salt diets were very common, which could also be, a result of some trauma. And then high rates of obesity and type 2 diabetes, high rates of heart disease, and then cancer. And I remember on one of the handouts in the educational materials this week in class, they talked about the link between trauma and then these heart disease, obesity, all those things. And then for food service management at the school district, I noticed systemic trauma in schools. So there's like this feeling of shame for certain dietary restrictions or practices of different cultures. And then poverty, again, I see a lot of kids that, want to get more. They seem hungry, but they're embarrassed to ask, stuff like that. And then some information about the provider-client relationship. I would say providing a personal opinion in an objective sense instead of being so subjective, try to share what you want to say without sounding too biased, I guess. And then highlighting positive habits and patterns when the patient would speak about the diet. This is something I would try to do always, something I was doing before I even knew what I was doing. And then praising the little accomplishments. And then shifting the focus away from body size and towards overall health. I think that's super important today. So here's some MI questions that I added to my week 1 assignment we did. So I said, what makes you think a change is needed? How confident are you in your ability to make a change with the help of a dietitian? What is the best thing that could come from this change? How does your health status currently impact your thoughts about food? What part about food and healthy eating is most confusing? What are 3 goals that will help you feel healthier? And then what barriers do you experience when trying to eat a balanced diet? So I wanted these all to be very open-ended, of course. And then some things that I have learned. Delivery is extremely important, so this can affect the overall message in a positive or negative way. Trying not to overemphasize behavior change. I think that just puts a lot of pressure on somebody as well. Asking more open-ended questions with no judgment really does allow the client to feel, more open with you. And then trauma causes different reactions, so you do have to be understanding. Some people respond very differently. And then the importance of understanding ACEs and the impact that this has on health and nutrition. I think to an extent I already had this, in the back of my mind, but really learning about that this week in the class has been very useful, and I'll definitely take that into my work as a dietitian. And then trauma causes different reactions. Whoops, I put that in there twice. So that is all for my week 3 discussion.